Okay, so it is the day before surgery. If you can see M in that mirror right there, it's because she's...
Hi.
You can see her in the mirror. It's okay.
Oh, shoot.
She's helping me with my laundry because tomorrow is surgery day.
And because I'm the best sister in the world.
Whatever. Yeah, because today she was telling me how, you know, since she just went through this procedure, she was telling me how, well, Morgan, you want to know how it feels? It kind of feels like, you know, when they do that branding on cows where they do that, they light that iron on fire. It's like that inside of your skin.
I was kidding. It's not actually that bad.
And then she tells me how, yep, and the incisions, you know, they're just open. So basically you're going to be oozing. And when you move, they just kind of open up a little bit.
Okay, no, I was kidding. The incisions are open though, and it is kind of gross, but...
And it does kind of hurt like hell. Like,
well, it's not, like, it doesn't feel good, but it's not that bad.
I know. But basically, I just wanted to check in, and if you guys didn't already know, tomorrow I'm having liposuction or slash like lipedema removal surgery. I will link our previous video in the, it'll be the first link in the description, because if you don't know what I'm having, then like this will make no sense. But we talked about exactly what lipedema is and why I'm having surgery and everything like that. But tomorrow, I actually have not said this on here. Yesterday, I had my pre-op appointment with Dr. Amron, and he was doing my like exam or whatever, just like checking in on everything. He confirmed, yes, you definitely do have lipedema in the arms. And we went over the areas he was going to be doing. And so what I was planning on is the arms, underarms, and upper back area. But Dr. Amron, being the freaking angel that he is, like literally, we love him so much, you guys. He's like saved our family freaking like, I can't even tell you. But he goes, you know what? He was kind of like examining or whatever, and he like goes down around the, you guys know what flanks are, right? I'm like wearing love handles because Em likes to talk about my love handles because I have some mad love handles. And I'm making you sound like such a horrible
As
sister.
I'm like doing your laundry, helping you get ready.
Anyways, yes, so he went down there and he was like, you know what, I want to do this for you. You're going to be in the surgery anyways. I want to go down and just get this done for you also, because it's a, you know, it's a big deal having surgery. So he didn't want me to have to like go through a whole other surgery and everything. So Dr. Amron's amazing, but that kind of changed the garment situation. I also wanted to talk about these garments because I honestly am going to wear these even when I'm done with like recovery and everything. It's this brand called Morena, and do we have packaging for them?
We did.
I guess I threw it away, but it's this brand called Morena. Here's the logo. And it's basically an antibacterial like garment, so it prevents infection and stuff. But the VP of the company happened to be in the doctor's office yesterday when I was there, so she like did a proper like measuring and fitting for me and everything, and she ended up giving me 2 garments.
That's so nice.
Which was, I know, like, God, I love this. I love Dr. Amron's office. Like, they're so freaking amazing. But I had ordered these ones. The 2 that she gave me are actually in the wash right now, I think. Oh no, she gave me this one, which so basically, long story short, the garment situation changed because he's doing my flanks, which are all the way down, and I had only ordered these guys, and they're black, so you're not gonna be able to see much, but it looks like a crop top, and then it has like 3/4 sleeves, but basically it has a closure right here, and then it's got a circle right there for your boobs, and then it has hook and eye and hook closures right there under there also. So I had only ordered these, but since he's doing my flanks, I need compression right there too, so she gave me this one, which this is the back. It's kind of cool because you know how like Spanx give you like hardcore flat ass syndrome, like pancake ass, you know? Well, these don't, because it's got the shapeage. So these go up under the boobs, and then they came with what do you call it, straps also if I want to, but you don't have to wear them. What else should I say? Okay, so let's just go over the day. Yeah, Emily's been waiting for me to like say like, so I'm having a psychotic breakdown. I've been like kind of freaking out today. I've been like having crazy manic like laughing attacks. and I just cried a little bit. And I'm just like having really mixed emotions. I'm not sure really what my deal is, but
don't cry right now.
I'm not gonna cry right now. You're being
okay.
dramatic.
I'm here. I'll be in the video. Hi. It's me. So tomorrow I'll be doing, am I doing a vlog?
Yeah, I mean, if you actually do it, like I'm uploading this,
no,
so
I want to do
you're
it
gonna
because
you're gonna have to be accountable.
I wish that you did that for my. Well, you said you were.
Okay, so what we're gonna do is Emily is going to film, edit, and upload the day tomorrow. So it'll probably be up in the evening because I want you to get like the whole day and stuff.
Yeah.
So what is there to say? So I want to talk about like the feels, you know, like how I'm feeling, because like I said, I kind of have been
it's gonna hit you tomorrow
out.
Like when I got mine done, I literally, like, they were putting my garment on and I started crying. Like like I lost it. And they were like, they didn't really know what to do. No, I'm just kidding, but they knew what to do. But I did start crying because I was like, oh my god, this is
after
so
it was
weird.
done, when they were putting the
yeah, like
on?
right after, because I was like, what the heck, it's over. Like, and my whole body is changed now forever. It's like a weird feeling because when you get anything cosmetic done like that, not that it was cosmetic, but since it is a change to your body, and like the way that you look is going to be so different.
This is what I'm saying, is that I have never had a procedure in my life that was like a body altering procedure to get results that I actually want.
Yeah, it's like I wasn't crying because I was sad. I was crying because it's like, oh my god, like it actually happened, and like I'm gonna see results that I was working for, and like, because you're gonna see the results too, that you've been training your arms so much, and you're gonna like see it.
It's just like everyone is saying that and stuff, and like I guess it's true and everything, but I'm not even trying to be dramatic or anything, but like I just don't see how. Like, I just have this huge feeling that, like, it's not gonna, like, work on me or something.
See, that was the opposite with me, because in the beginning I was like, yes, like, tomorrow, by the end of the day, I'm gonna have, like, such skinny thighs, and I'm gonna be so cute. And then I ended up swelling up so much, and for the first 6 weeks, I thought that it didn't work on me. Like, I was convinced that, like, even though I saw the fat in the bag, I thought it didn't work on me.
Yeah.
So, no, but it's literally impossible not to work. You're gonna see the fat tomorrow. We'll take a picture of it too. That'll be in the vlog.
I'm just worried about the, like, I already have so much loose skin. This is what I kind of had a little bit of breakdown about, like, literally 10 minutes ago. I already have so much loose skin, and like with you and stuff, and I guess with most lipedema patients, like your skin was like full, you know, like of the lipedema fat and everything, but it like mine is already all loose and stuff, so your skin is like, it was used to being tight against something, so it would like contract and everything. Like you don't really you don't have loose skin now. I already have loose skin, so taking even more out just worries me. And like, yeah, I know that I'm planning on having
for that time, but it's gonna feel so much better. And you don't know, your skin could totally like just get right back to normal. Obviously you are gonna have loose skin because you already do, but it's not, you can't think that when you take all the fat out that the whole section is just gonna be loose skin. At least for like 100%, some of it is gonna go right back to normal. And yeah, you are gonna have a little bit of loose skin, but that's because you've already lost 100 pounds.
Yeah.
And you are gonna get your, what is it, brachioplasty? Is that what it's called? The arm lift?
Yeah.
And like getting this could possibly make it possible to only have the incision in the armpit. So if you have to live a year, no, it's only 6 months with more loose skin than normal. Think of your whole life.
No, I know, it's just easier said. Like, I didn't think, like, I thought that having, you know, waiting a couple years, like, before I actually had loose skin, I was like, yeah, like, I can, you know, I can live with it for a little bit before I'm able to have, like, plastics and everything. But living with it is, like, such a different... Yeah, like, you know, I'm a confident person, but honestly, like, when I look down and see, I mean, you see it all the time, like, you don't, she's not mean about it or anything, but, like, she looks and she's like, oh my god, because I'm not wearing turtlenecks all day, like, as a girl with big boobs, like, your chest shows, but, like, when I look down and it's literally, like, piled up skin, that freaking, like, takes a toll on your, like, confidence, you know, and... I'm not saying that like my body is ugly,
like a chance that you could be left with a lot of loose skin, but just think, like, right now as we speak, and like since forever, the extra fat in your arm is harming your body. It's making your skin on your arm worse and worse by the second.
I know.
So when you take that out, you're helping your body and you're making a positive change because you're not going to be living with it hanging on it and weighing it down and making the skin worse.
Yeah.
It's gonna be okay.
Thank you guys for all the love on Snapchat and everything. I've been getting like messages and stuff, and I feel like I just want to like say thank you to everyone. Okay, mushy gushy for a second. It's really cool too. I feel like, you know, I've had my family and stuff, like Em and my parents, through obviously my whole life and everything, and I really clung to them even when I just wouldn't maintain like other relationships and stuff. But to quite a large extent, it's like for a lot of years I feel like I've kind of been like doing life alone, and of course it's good to be selfish and everything and to focus on yourself sometimes, but I've done that for most of my life, which has been good in a lot of ways, but it's just like a really big, it's really cool to like not feel like I'm completely alone in doing this. Like I don't feel like I'm alone anymore, and it's because like I've been able to have this like rad ass community on Instagram and Snapchat and YouTube and stuff too, but Instagram is where it all started and stuff. And so it's just like, it's cool knowing that I don't feel like I'm like alone anymore, and that's
cute.
Anyway, I'm just gonna upload this like this right now.
Okay.
Do a little bit. Maybe I'll add some like
sassy ass music.
That was weird.
Well,
Anyways,
yeah.
I'll be snapping. I'll be snapping tomorrow when I can and stuff, and I'm sure I'll be all loopy. But this one's gonna do some vlogage, and then I'll also update you guys probably like a week post up or something. But I love you so much, and thank you for all of your support. And I'm gonna stop talking. Goodbye.